I'm not going to talk about myself, I'm going to talk about someone whose name is John. John is a patient that goes to his physician and he's feeling ill. He's getting a prescription of some drugs, and then he goes home taking regular medications, and after some time, he doesn't feel well. Why? He doesn't know. He goes back to the physician again. I'm having other symptoms and I haven't been treated. So what is going on? The physician does the lab tests and sees that there's another disease, which is a co-disease, that's infecting him. So he's writing another prescription and giving it to the patient again. Patient goes back home with polypharmacy, having multiple medications, and he is still not feeling well. Why does this happen? A common problem here is the quality of drugs that we are consuming. Are those drugs that we have here that are marketed and dispensed to patients having the standard qualities, or do they contain the right amount of drugs and the right amount of the active ingredient that is needed to treat those diseases? So, the aim of our study, and why I'm talking to you here, is that it's in one point. The WHO in 2017 conducted this research which states that a study on the public health and socio-economic impact of what? Substandard and falsified medical products. It states that 10.5% of the annual production of drugs, 10.5. So in each 10 pack of drugs, there's one packet of drug which is a falsified drug, which is a substandard drug. So just imagine this: in every 100 packet of drugs that is available in a pharmacy, 10 of them is a substandard drug or is a falsified drug. So it does not even contain the active ingredient. It's some other thing, which our people call JIT. And it is true. So, what is the goal of our research? Why did we do a quality control test on some tablets which are available in the market? The goal is to prevent the production of substandard drugs inside of the country, which we have two major manufacturers of drugs right now. So if we do those tests, we can prevent them from producing substandard drugs if they do. The second thing is preventing the import of falsified and substandard drugs. We know that it is a huge business. The drug business is a huge business. So if you import drugs, you are making a lot of money. But are you making a lot of patients happy? Maybe not. The WHO in this study also states that the global expense of middle-income countries on substandard and falsified drugs is about $30 billion each year. And also in the same study, it says that the burden of those falsified drugs is about 1 million deaths per year just because of those falsified drugs. So this is a very huge project. If we just see it, it's a very huge problem. So why are we not focusing on that, especially in our country? And doing the literature review for this subject particularly, I didn't find any sufficient data. I didn't find it in Iraq and especially in Kurdistan, except for a few researchers that you can just state it by your hands. Okay? You cannot find literature review for this subject. Why? Why don't we care? Why the pharmacists, the doctors, also the regulatory bodies in the Ministry of Health and in the Quality Control Commission in Kurdistan, they do not care about research-based approach to this issue. So that's why we are here. We're here to present to you this idea in order for you will become researchers as well if you want it. So we want you also to continue this path and do a better work than we have done. So, why, if we conduct this research, what benefits would we have? Number one, we are going to make a lot of people happy, and especially patients. Because the patients, when they go home and they're taking the medication and they see their symptoms are disappearing, they become happy. Their quality of life changes. They do not pay extra money for other medications that they should buy. So that's why we conducted this. According to the procedures that we followed, it's all available in USP, so I'm not going to concentrate much on that. the first thing we have to determine what we have. We chose Clopidogrel, and as Dr. Salah, which he presented his presentation about heart, and how could someone live with a good heart? So if you do not have a good heart, you're not living well. That's why we chose Clopidogrel, because it's used for major treatments of ACS, which is acute coronary syndrome, and also percutaneous infusion. Patients undergoing CABG should receive Clopidogrel post-operation. So the first thing we have to do in quality control is the FTIR study. We have to determine if this active ingredient is actually Clopidogrel or not. If it's something else, we omit this drug and we throw it away and we destroy all of it. So when we conducted it, we followed the standard steps and procedures. You open this lid, you put your drug, and it gives you a spectrum that I'm going to show you later, so you can determine if the functional groups are the same as the Clopidogrel standard. The second thing is the melting point apparatus. Unfortunately, we didn't have the automatic melting point apparatus, so we used the manual one. We have to observe it. This one is the Clopidogrel that you observe at what temperature it starts to melt and at what temperature it actually melted. So you will get the melting point. So that's how you determine the Clopidogrel as well. The third thing is the lambda max. You determine the wavelength. It's also used for the same purpose. And then you get the calibration curve with this device. The calibration curve is the most important thing in this quality control test, because in every single other test, such as dissolution test, you have to have the calibration curve in order for you to know if this concentration that you are having is actually the same as the standard or not. If this concentration is lower or it's something else, it means that you are having a substandard drug. So, what are the tests that are needed for actually the formulation? So now we have the active ingredient. We know that the drug that we have in hand contains Clopidogrel bisulfate, contains the active ingredient, so it's working. So now we have formulated the tablet. Are those tablets worthy of being consumed? So if the patient is consuming this tablet, is he going to benefit from it 100% or not? So the first thing is the weight variation test. The weight variation test is used for you to know that it contains the same amount of drug in each individual tablet or not. So you have a sheet which contains, for example, 14 tablets. Are those individual 14 tablets contain the same amount of drug or not? The second thing is the hardness test. This machine, you put the tablet into it and it analyzes for you the force that is required to break the tablet. Why is this important? When you consume a drug and it reaches your intestine, it starts to disintegrate. If the hardness of the tablet is too high, the drug does not disintegrate easily and you cannot benefit from it. So the action time will be increased and the start of the effect of the drug will be also prolonged. The third thing is friability. Although the tablet that we used was film coated, and film coated tablets does not require the friability test, but it had to be done for the regulatory procedures. So disintegration, this is one of the most important tests that we did, and we have to focus on it. And it is the ability of the tablet to disintegrate fully and release its drug contents into the body, so that it will be prepared for absorption. So in this device, it contains 6 tubes. On those tubes, you insert the tablet. This solution should be the same solution that you have in your stomach, because if the drug dissolves in the stomach, so it should be the same drug, which we use 0.1 normality HCl, which is close to that. And it should be 900 milliliters. It is 900 milliliters. Why? Because the stomach keeps 900 milliliters of fluid at every time. So if you open your stomach, you can see about 800 to 900 milliliters of fluids inside your stomach. The third thing is the dissolution test. The dissolution test is actually done for drug release habit of the drug. So how is the drug releasing its contents for the body to be absorbed? Is it slow release or is it a prolonged release type of drug? So if the contents of a drug is releasing slowly, so the action time will be increased. If the drug dissolution is having a small amount of time, so the absorption will be higher and the effect will be better. This is the dissolution apparatus that we have used. Now we come to, these are also some other tests that we use. They are not very important. We come to the results and the conclusions. This is the result from the FDIR for the clopidogrel powder. So this is the original drug that we use. These peaks are the functional groups inside the chemical compound clopidogrel bisulfate that we have. So we have to compare those two with this one. So if we see that those peaks match the peaks from the powder, so we determine that it actually contains the active ingredient. But if it doesn't match, it means that it's some other drug or there are many impurities in it. Melting point, we found that the melting point was 186. Actually, clopidogrel bisulfate is 184, but because we use the manual apparatus, there may have been some errors, so that's why there was a 2 degrees false result in that. Determination of clopidogrel lambda max. This is the UV machine. UV machine is used to get the wavelength which that specific compound absorbs energy, absorbs light energy. And we found that it was 218. It is the same as the standard that we can see in the USP pharmacopoeia. This one is the calibration curve that we get when we do the UV tests. So when you get this calibration curve and you do the dissolution test, whenever you get some kind of concentration, it should be on this line or near to this line. If it is not, it means this is a falsified drug substandard, doesn't contain the right amount, so that's why you need this calibration curve. For the weight variation, we use 2 brands. Those 2 brands are locally manufactured in Kurdistan region. That's why we focused on doing something that the factories here are producing, because we should know at first what we are producing. Are they quality high or not? That's the first thing, because it's local and people may believe that if you are consuming local drugs, so you are giving some kind of a help to your country. But are they worthy to be taken or not? Or which one of them is better? So here we found that clopidogrel A from a company and clopidogrel P from another company in a different city. We found that the weight variation in clopidogrel A was lower. So the total weight of the tablets were lower actually, but here they were higher. This means that there's a difference in concentration of the active ingredient inside those 2 tablets. So here we found that also individual tablets where the results was closer to each other. So it means that they have a constant regulation procedure, but not this one. So there may be a problem with that. The second thing is the hardness test. There was a huge difference. Actually, the hardness in newtons was, the maximum was 4 for clopidogrel A, but for clopidogrel P was actually 9, which is wrong. It should not be like that, because it affects disintegration. If tablets are too hard to be broken, disintegration will not happen at the required time. And we actually saw, and you can see in disintegration results, that it was different than this one. So here we can see it easily dissolved inside the disintegration apparatus, but this continued for about 6 to 7 minutes and it didn't dissolve. Film-coated tablets regularly have to dissolve, according to the USP, in 5 minutes, but this, look, it reached one of them 9 minutes and another one 7 minutes. So for the friability test, it was not important as I mentioned, but the disintegration test, as you can see, because the hardness of this tablet was lower, the disintegration is higher, so it's easily dissolvable inside the stomach. But this one had lower disintegration property. This is the potency test. The potency test is used to determine the potency of drug, the content of a drug inside the tablet. So we saw that here, that CLA and CLP have different values. And you can see from here that this one actually had low potency, which is the Clopidogrel P, than Clopidogrel A, which can give us a wide vision that there are differences between some attributes, that CLA is in some of the characteristics it's higher, and the other one is from some of the characteristics are higher. So in conclusion, what do we get? We see that there are vast differences in the characteristics of both brands, which one of the most important one is the disintegration and weight variation. We see that one of the companies that are producing those kinds of drugs actually does not contain the required amount of drugs. So that's why people, when they're consuming those drugs, they're not getting the exact efficiency possible for this drug to give us, and so the patient will not be treated very well. So that's why superiority and inferiority of quality of the samples that we are testing is important to be evaluated. And one of the most important things that I have to mention is that as pharmacists, when we do quality tests, because people are not doing it, if we encourage other people to do those kinds of researches, we can give the idea to the regulatory bodies in the quality control so that they can step forward and ask us what should we change in regulatory properties. Because if they are following something and we are not actually governing them, so there will be a problem. We have to give them a vision and that there are other people doing the same work as well. If the quality control directorate is not doing something right, we have to show them that it is not right. Staying mute will not change anything. So thank you very much. I'll be more than happy to, if you have had any questions. Thank you. Yes.
So it means that the quality control, they have some issue in the processing of the quality control.
Of course, because those samples that we obtained it from a local pharmacy. So if I was a patient and I went to that pharmacy and I'm buying this drug, so how could I know this is a substandard drug? The quality control director should know that. So why did they allow this to be produced and dispensed in the pharmacy? So there must be a problem there.
And it would be better and more significant if you included more other companies, so you see a more difference.
Yes, exactly. But why did we do that? Because we have only two companies here, and we'd like to compare those two companies and which one is better. And we saw that the CLP was actually better than the CLA, which all of you, I think they know what that means, but we do not mention the names. Because the difference in quality from one city to the other, or from one company to the other, it was very different. And I don't know why is that. Do they follow another procedure? Do they follow Indian pharmacopoeia and the other one follows USP or British pharmacopoeia? Or what other differences are? We have to check that, but it's not our work actually, it's the quality control and the Ministry of Health's work to do that. So that's all. Thank you for listening. Yes, sir. Yes, sir.
Why are not mentioning exactly
The company,
Yes, because for ethical procedures, we should not mention company names and their brand names in researches. We have to code them. So that's why we do not mention their names. It's because it's not ethical, except if we get permission from them. That's why.
but at the same time, it's not ethical to people having the medication that's
It's more unethical.
It's more
actually.
unethical.
Yeah. So this is a problem. We hope that it will be solved. Thank you very much.